Well, let's take a closer look at the issue of healthcare in the U.S. Al Jazeera's Rob Reynolds is at a community clinic in Charlotte, North Carolina. Rob.
Yes, Adrian, we're in the waiting room of the Charlotte Community Health Clinic. And, of course, this issue has been very much front and center for several years now, and it's a hotly debated topic on the campaign trail. This is a center that serves the needy, people who do not have health insurance and who generally are low income. And I'm joined now by the executive director of the Charlotte Community Health Clinic, Nancy Hudson. Nancy, thanks for speaking with us. Are you able to serve all of the people who come to your door for help?
No, we're not. When we began the clinic, we had a waiting list when we started it 11 years ago. And we continued to add staff, we added volunteers, and in July of this year, we turned away 467 patients.
So there's still a big need there that is not being met.
Huge. Mm-hmm. Okay. Absolutely.
Now, do you feel that the Healthcare Reform Act that has been passed and whose provisions will go into effect in a couple of years, once all of those provisions are in effect, do you think that's going to have a positive impact here?
I think it will. All of our patients are 200% of the federal poverty level. The new health care law would have everyone covered at 139%. To me, the issue is looking at industries. Who are the uninsured? They are manufacturing. They are construction people. They are retail. And we have so many working poor. What our nation needs to look that we do provide health care for the uninsured. We just provide it in one of the higher cost areas, which is the emergency room. And who pays for that but you and I in our premiums and businesses. So we get, our patients do get health care, but it's at the most highest expense and the greatest cost to their health, whether they're diabetic and they didn't want to go to the doctor because they did not have the money. They couldn't manage their diabetes. So they went when they felt really bad or had a stroke from their diabetes or cardiovascular disease. They ended up in the emergency room, which is more cost on us as a government or us as a people to be able to pay for that. One of the concerns I have is we're not looking at the efficiency of what we need to do with our health care. You know, we're paying hospitals a disproportionate share for their uncompensated care. Well, if we take that disproportionate share that they're already covering the uninsured in their hospitals and emergency department and put it into something that's prevention, we will have a healthier workforce. Right now, we're not having, and we're moving away from a healthy workforce.
All right, Nancy Hudson, Executive Director of the Charlotte Community Health Clinic. Thanks very much. Just to point out as well that Governor Mitt Romney, the Republican nominee, has vowed that one of his first priorities, if he is elected president, will be to abolish the health care reform enacted under Obama. Adrian, back to you.
Rob, many thanks. Rob Reynolds live in Charlotte, North Carolina.